Blood vessels. Well, the large ones have 3 layers, and I'll be talking about these. Nice footage here of actual arteries are going to branch into arterioles, and the arterioles finally branch into the tiniest of the blood vessels, the capillaries. There you have it. Angiogenesis. What a cancer tumor will do is it'll release these angiogenic factors and create its own blood supply. So angio, think of heart or blood vessels. Genesis, think of the Bible, the beginnings of blood vessels. So our treatment is to produce these anti-angiogenic factors and starve these tumors out. We also have these chemicals for retinopathy, because some sorts of disorders of the eye, the blood vessels cause problems and lead to blindness. So there's lots of uses for anti-angiogenesis. I mentioned there's layers, and there's reasons for these. The interna, take a look at the lower right. It's mostly an endothelium, which is a single layer of squamous cells. They're just flattened, they're shaped kind of like fried eggs, and very fragile. And then a basement membrane beneath that to hold it in place. And there's some stretchability. We want these vessels to be able to expand and contract with each beat of the heart. The media, which we think of middle, we see here, and these are rings of elastic fibers. And they control the lumen diameter. So the lumen is the opening of the inner opening of the diameter here. And so when you blush, let's say, then we have vasodilation, the blood vessels around your neck and face. And when we're cold, like our fingers, we can barely feel our fingers. We have vasoconstriction, and that's a contraction of the tunica media. The externa, as you might guess, is the outer layer, and that's where we have blood vessels and the vasa vasorum, and also nerves. And so this is where we have, if we have angina and not enough blood getting to some tissues, we have pain, and that's due to those nerves. Arteries, these are the large ones. We have elastic ones, and these are the big, massive, such as the aorta and the pulmonary trunk of the heart. So they're more interested in volume, and they tend not to be as thick, and they have great capacity to expand and recoil, and that propels blood onwards. And we have diseases where the hardened arteries don't expand and recoil, and the poor heart has to pick up that workload, and we got problems. There are muscular arteries as well, and those are further downstream, and they're not as elastic, but they have to have muscle tone for that expansion and contraction. Anastomosis is just where we have several arteries supplying the same body region. So let's take a look at the hip. Here's a hip joint. And if one route is obstructed, maybe there's trauma or there's some sort of embolism, then another trunk of another blood vessel picks it up. It's called collateral circulation. Now, it's not always this way. In fact, there's necrosis of the femur. Some famous athletes have had that because of a blow here. So it's not a perfect system, but it does help keep tissues alive. In our introductory video, we saw there's arteries, and then they're going to branch into arterioles. And they have smooth muscles and precapillary sphincters. And let's take a look at these. And these are going to regulate the amount of blood flowing into capillaries. Capillaries are the smallest ones. See, we don't just dump blood. It's not like a plumbing fixture. Some people think blood vessels are like plumbing, but we're going to regulate what blood goes where. I mentioned when you blush or when you're cold, vasoconstriction, vasodilation really regulates where the blood's going to go. And of course, sexual arousal is largely influenced by blood flow. And so those precapillary sphincters are wide open in our genitalia there. Capillaries, tiny. And in fact, red blood cells just travel single file, or they have to fold as they go through these. And they're more abundant in tissues with more activity: kidneys, brain, muscles, liver. They're going to deliver oxygen, nutrients to those capillary beds, and that's what we're seeing right here. Is kind of the joint it's not a complete connection here like it shows. It's more of an open bed where the veins are going to, venules, excuse me, are going to pick up the waste products and the carbon dioxide and so forth. Venules, the post-capillary venules are right there at the capillary bed. And as they move away, they're going to get thicker and become veins. And veins, interesting, they have the 3 layers, same as arteries, but their walls are much thinner because they're not pumping. Because look at this, at the capillary bed, the pumping action is essentially gone. And now we need these skeletal muscles. So if you sit for long periods of time, you might notice that your feet get cold. And that's because inactivity, when you don't move enough, then you're not pumping blood back to the heart, and you get this sluggish flow. Not a good thing. Continuing with veins, we have veins that become, well, okay, let's first mention they're more abundant in arteries. In fact, much of our blood is stored in veins, and we have superficial veins, which you can often see near the surface of the skin, and deep veins as well. And the valves will close. Let's see, not a good example here, but see these little cusps on the vein. As blood moves forward, and then it settles back, these cusps fill, and they close, and onwards and onwards. And this is a beautiful design unless you put too much pressure on these regions, the regions superior to the valves, and then we get something called varicose. And in this case, there's a lot of reasons for varicose. It may be valvular defects that, as I mentioned, like if you're standing for long periods, you have a lot of weight, body weight, like especially pregnancy. Then what happens is these cusps and this whole region gets under pressure and starts to stretch. And sometimes just age. And we get these varicose veins. And let's look at this in greater detail. To the left, you'll see a normal vein. I've just been talking about this process where blood is squeezed. Remember, skeletal muscles are going to squeeze the blood upwards. It's going to go past the valve, and then the cusps are going to catch the blood, and the valves are going to close. And that's the process we want to see. In a varicose, what happens to the right of this leg is that we'll call it a warped valve or a defective valve. And now we have this tissue is stretched. I hope you can see it. The blue lines here are thinner than they are in the healthy one. That indicates some damage to the smooth muscle lining of there, the intermediate layer there. And not only do we have stretch and expansion, but we also have damage here, so we have backflow. And so this is going to backflow, and then the valve below it gets affected. And so you can see, instead of having just one varicose, sometimes there's a series of them because this whole backflow issue is like a domino effect affecting the vein downstream. Let's talk a little bit about, okay, some are mild and some are, the superficial ones sometimes we see in the calf, or hemorrhoids in the anal canal. Those are types of varicose. Those tend to be venules in the anal area, perianal. But some, such as the esophageal varices, they're called, can burst and cause internal bleeding and even death. So there's a range of varicose, and it's not just in the calf, just so you understand that. Some of the treatments, elastic stockings, is the first conservative approach, and then injection or sclerotherapy, or radio frequency, which is kind of neat. I haven't seen this one done, but what we're trying to do here is look below. You see a vein, and our purpose here, it seems kind of strange, is to constrict it and shut it off. And in that way, and believe me, there's a lot of veins in the body. I mentioned there's more veins than arteries. And so if we have to lose the service of one vein, there'll be others that'll pick up. Remember that collateral flow idea, collateral distribution of blood? So there'll be collateral veins that will pick up on that workload, and everything will be fine. The last method is stripping, where the vein is excised or removed from the body, and that hopefully that can be avoided. Often just elastic stockings, elevating the feet, getting off the feet, losing weight can work in many people without going to the extremes here.